Hello everyone, my name is Ethan Firestone and I'm an MD PhD candidate at the Wayne State University School of Medicine. Pertinently, I'm also the co-founder and chairman of the Wayne State Fresh Prescription site. We are so thrilled to have you as a prospective healthcare provider for our Fresh Prescription program, and I'd like to take this opportunity to give a brief program introduction and outline our expectations for you. Fresh Prescription is a Detroit-wide conglomerate of healthcare providers, community development centers, produce vendors, and others who are all dedicated to improving the health of our residents. At Fresh Prescription, we believe that health starts with what you put in your body, and so we emphasize the importance of healthy eating and nutritional education as a way to prevent and combat chronic conditions. Our organization gives qualifying patients a literal prescription for up to $90 of free fruits and vegetables that can be filled at participating farmers markets, produce stores, and through a food box delivery system. Participants also work with our staff to receive free longitudinal nutritional education, personal goal tracking, and biometric monitoring. A brief history of Fresh Prescription: the program started through the Ecology Center in 2013 at the Chas Mercado in Southwest Detroit. Since that time, we have grown to include 7 sites around Detroit and are now overseen by the Eastern Market Partnership. We are currently working to become a nationally recognized covered insurance benefit for our patients so they can always have access to healthy fruits and vegetables. You can see a list of our 2019 partners below, and you can check out our website, detroitmarkets.org/freshprescription, where we have a number of photos, a brief program overview, links to all of our past reporting, and a few other things. For the Wayne State site specifically, I brought Fresh Prescription to the School of Medicine in 2018 as a small pilot of 19 patients from the Robert Frank Student-Run Free Clinic and Ford Resource and Engagement Center on the east side of Detroit. I feel it's critical for young physicians in training to understand the importance of healthy eating and nutrition as cornerstones of their future clinical practice. In 2019, Wayne State Fresh Prescription partnered with the Cass Clinic and the Wayne State Farmers Market to help 47 patients. We recruited those patients through the Cass Clinic and had tables set up at both the clinic and the farmers market. There, we would do our surveys, our goal tracking, biometric monitoring, and load funds onto patient cards. As for the process, it begins with you. As healthcare providers, we ask that you identify potential patients based on the eligibility criteria outlined to the right. Patients just need one of the following conditions to be eligible: hypertension, hypercholesterolemia, diabetes, or obesity. At that point, the patients are handed over to us, where we will complete the entirety of the program. As I mentioned before, the prescription is good for up to $90, which is loaded onto one of our Fresh Prescription debit cards and can be spent through the app as depicted below. That $90 is split into 6 loads of $15 for a total of 6 sessions. During those sessions, we have participants do a brief nutritional education session, have their weight and blood pressure checked, and also check in on their personal goals. After they have completed these required items, we will then load $15 onto their card. So participants need to visit us a total of 6 times to get the entirety of their prescription filled. They can take those funds, which roll over from week to week, and spend them at any of the markets listed below, as well as a few produce stores such as Peaches and Greens and Red Truck, or through a food box delivery system. Our program typically runs from July through October, and it's on patients to come visit us whenever they are available. In 2020, we are so happy to now expand into 4 clinics through the Wayne State site to help 120 patients. In addition, because of COVID, we have had to create a remote model for this year where we will use a telemedicine platform to conduct all of our visits, and our produce vendors, Eastern Market, Peaches and Greens, and Deeply Rooted Produce are going to be doing food box deliveries directly to patient homes so that they can avoid potential exposure going to farmers markets. As for the virtual process now in 2020, because of COVID, it still is the same for you providers. You will identify potential patients, and you will hand them one of our flyers that has contact information so that patients can call or email us directly and get signed up. During their sign up, we will give a virtual orientation, have them sign a consent form, get a virtual card, pre-survey, we'll do their first nutritional education, and we'll have them place their first food box order. The next week, the patients will receive their first food box and also some sort of a blast message through either text or email. Then every other week, we will check in to do our goal tracking, nutritional education, and have them place food box orders, which will be filled in the intervening weeks. This year, as you can see, the program will run for a total of 12 weeks for each participant. As for provider expectations and talking points that we would like you to discuss with your patients, our expectations are as such. We would like you to please conduct a screening and identify potential participants based on the inclusion criteria below. And then during those clinic visits, please give them a brief introduction to Fresh Prescription and inform them of the possibility to join by handing them a flyer and encouraging them to call or email the address provided either while they're at the clinic or at any time to sign up. In the event that not enough patients are taking the initiative to call, we ask that the healthcare team will please provide a HIPAA-compliant list of contact information for eligible participants so our Fresh Prescription team can reach out to them directly. We also ask that you please collaborate in our IRB-approved FreshRx research by providing agreed-upon, de-identified biometric data from clinic visits such as blood pressure, BMI, lipid panels, A1C, etc., and of course, we are open to more intensive participation if desired. To reiterate, for program eligibility, patients just need one of the following conditions: hypertension, diabetes, obesity, and hypercholesterolemia. This year, because we are doing everything remotely, we ask that participants be a resident of Detroit and also have access to either a phone or a computer. Now, finally, for the points that we'd like you to discuss with your patients, let them know nutritious diet is a cornerstone of good health and can help prevent and combat chronic conditions. Please let them know that Fresh Prescription is a Detroit-grown, citywide network of healthcare providers, community development centers, farmers markets, and produce vendors, and we give participants a literal prescription for free fruits and vegetables worth up to $90. In addition, we will provide participants with free nutritional education, goal tracking, and biometric monitoring. Then, let them know that they can sign up by contacting the phone number or email address on the flyer and that it's a 6-session program administered by Wayne State University medical students. Finally, inform them that due to COVID, Fresh Prescription 2020 will be completely remote and conducted through our telemedicine platform via phone calls, video chat, or email, and that money can only be spent on food boxes that will be delivered directly to the patient homes. I want to thank you so much for listening, and I'm so excited to have you as a potential partner for our program this year. Thanks a lot. Have a good one.